lot
Yeah,
around
right.
devices, and I think that's the one area that we haven't necessarily touched a lot on. I noted when you were talking about ransomware, for example, that it's still prime despite all the PHI there. Can we sort of maybe talk more about how these frameworks can support risk remediation through after the risk assessment, but also how their footholds rather than necessarily collecting data and the security elements around that. Let's, yeah.
Do you want to start, Will, or do you want me to like dive in?
Yeah, go right ahead.
Okay, so I mean, the framework that Will touted and like those resources, he said they're awesome, right? I've read them, and they're like everything, a more detailed version of everything that I think a framework should entail. But at the end of the day, I'm assuming you're at organizations and you have finite resources and you have finite personnel. And so all you can do is, either through internal consultation, or if, can afford to pay for external consultation, you need to rack and stack. You need to prioritize all of the different projects that your organization needs to do. And like really right now, I see a lot of organizations not even having the basics. They don't even do two-factor authentication. They don't even have like user access management, like where only certain personnel should have access to certain files, right? Like someone in the accounting department should not have access to, like a patient's medical records. Maybe they can have their payment records, but I don't even see that. So I would say specifically for a lot of small and medium-sized organizations, really prioritizing the low-hanging fruit. And I'm like foot stomping multi-factor authentication and user access management as like the two things that I see over and over again. I'll let Will like chime in as well.
Yeah, I agree with that a lot. I can't stress enough prioritization, because if you go line up, I've seen lots of smaller, especially smaller and mid-sized organizations. You can have a lot. If you go look at NIST, or if you go look at 405D, the HICP framework, you can end up with a pretty significant list of things that you need to work on. And the next big step is prioritization. And can't stress that enough. It's about analyzing that risk and really developing a prioritized approach to moving your maturity up. There may be, can't solve everything. You don't have the resources to work on everything at once. But that's why prioritization is it has to be the first thing that you work on, is prioritization and understanding the risk and impact, and really doing a proper risk analysis so that you can have an informed prioritization. I saw some other things in there. I saw a little bit of talk about segmentation and some other things. HICP does talk about network segmentation. That's one of the ways to mitigate risk, is mitigating controls. You can't solve all risk directly. Sometimes there may not be a patch for something. You may have an older device. You may have a medical device or an MRI that's 10 years old that you're not going to replace. But there are mitigating controls. You may not be able to patch that device, but that's why exploring the risk and the impact and those mitigating controls are so important. And there's a lot of great advice in HICP around mitigating controls in every one of those areas.
And correct me if I'm wrong, but segmentation is one of those things that's not necessarily a cost prohibitive item. It's more of a time and prioritization, right? So that sort of comes back to that key element.
Yeah, the mitigating controls may not cost much sometimes. Some do. Big network segmentation projects could be, across in a big enterprise, can be pretty expensive. But some mitigating controls don't cost very much. You might, but replacing the device, if the MRI or the CT or some medical, huge population of medical devices like pumps, for example, the capital to replace those devices can be enormous. So, upgrading the device to a new MRI just to fix the security problems is a costly endeavor. And there are ways to mitigate those risks and get to, for most organizations, a reasonable risk mitigation, or residual risk is very low after those, even though you're running an older device. And sometimes it's not a single mitigating control. Sometimes there's 2 or 3 things that have to be done on or around a device. to make it get to a reasonable risk level. And replacing the device may not be an option. Most of the vendors will gladly sell you more devices to update those, but that's just a capital prohibitive option, especially on these devices. Unlike, you know, medical devices, we expect to last a long time. The lifespan of medical devices and imaging devices are longer than typical IT devices, and that means we have to look for other creative and mitigating controls around them.
Yeah, I completely agree with Will, and I'll just give a couple of examples of like best practices I see like hospital systems using is they'll have multiple networks, right? Like they may have a network specifically like the corporate network where everyone's emails and, you know, accounting and everyone else marketing is on. They may have a network that the doctors and nurses, like the specific medical, you know, network where they keep track of all of the stuff, you know, when they're meeting with patients. And then like, as Will mentioned, with older biomedical devices, that can be on its own network, right? And it will require different scrutiny, right? Because you're worried about software that can't be patched or updated. So you have to have better scrutiny of that equipment. And then there may even be another network for if you want to bring your own devices to work, right? If you're a smaller organization and it's, you know, BYOD. So also a different level of scrutiny. So like that's one best practice that I've seen. Yeah, another one is just like to have it on an intranet, like the old equipment on an intranet, not even connected to the internet, right? So those are things depending on what your organization needs it for. It's always a balance between convenience and security, right? And I know like the magic is trying to make security as frictionless as possible, but we haven't gotten there yet.
This is true. I am seeing a question about cyber biosecurity. Can either of you speak on that?
That is a field that I have not worked in, you know, like I wanted to be fully honest. I've got enough to deal with just cybersecurity. Like to add another layer, to add the bio piece of it is beyond my organization's remit at this point.
Thank you.
Something kind of tangent and related a little bit is, you know, genetic data, the research data. You mentioned research. We see, I'm sure you see, Elvis, the motivations of folks of why they might want data vary pretty wildly from what a nation state might be after for getting data. Might be very different than some other criminal hacking group trying to get the same data. Their motivations can be very different, for everything from espionage to, you know, maybe a nation state is stealing a drug formulary because they're trying to save $1 billion in the development of something and jump ahead and move in a market. So that's not something that's going to end up on the dark web. It's something they're stealing it for different motivations. And so those motivations around research, I have found around research data, genetic data, and so forth, the number of possible motivations vary so wildly on what those different groups might be after that data for. And sometimes it's not obvious, actually, in some cases, what the motivation might be. Okay, so any other questions we had coming up, Jessica?
No, I think that was pretty much it. And I think that we are at the end of time. Do you guys have anything final to add? All right.
Well, thank you very much.
We are grateful for your attendance, and we're, yeah, feel free to reach out to us if you need further information. Thank you all very much.